Hello there, welcome to Health and Flavour, a three-part program where we talk to medical practitioners on various diseases, learn a few tips with regards to clinical and nutrition intervention. We also include physical fitness segment. Exercises are a large part of our well-being. Welcome to the program. My name is Bill Hawaka, and here is a preview of what to expect on our program today.
1, 2, 3.
Cancer is an abnormal growth of cells. We call it, in more technical terms, mutation in the cell DNA.
Yes, it's actually one of the most frightening conditions that we have nowadays.
True.
Yes.
Very true. Arguably, cancer is one of the most common non-communicable diseases in the 21st century. It is the second leading cause of death globally. In 2015 alone, cancer was responsible for a staggering 8.8 million deaths worldwide. We went out to talk to the public and get a feel of what they know about cancer.
My understanding about cancer is a disease that is a dangerous one. Once you acquire that disease, it is a disease that will take you to your death. So that's my understanding about cancer.
Cancer is mainly caused by, let's say, unhealthy living or unnecessary, or let me say, like infection of the cells by metallic substances, maybe.
Basically, I don't know much about cancer, but I guess it's when cells grow in your body, like cells that are not part of your body, yes, that make a dysfunction in your body.
Cancer has the potential to affect any part of the human body. The effects are severe, but if cancer is diagnosed and detected in its early stages, then a cancer patient can recover fully from the disease. Let us delve deeper into the subject of cancer with Dr. Mboya.
Cancer is an abnormal growth of cells. We call it, in more technical terms, mutation in the cell DNA. So it's a condition whereby the normal cells in a body reproduce much faster than normal, leading to growth in masses. The signs and symptoms that are associated with cancer depend on the specific type of cancer. So for instance, cancer that is related to the prostate, which is more common in men. In fact, the risk factor for that is that if you are a man, chances are that you may develop this particular type of cancer. And so there are those symptoms and signs that are specific for the type of cancer, but we have general ones that can be seen in all types of cancer. So for those that are general, someone may have anemia where the cause is unknown. You're eating well, you're exercising well, your diet is balanced, but somehow you're just becoming anemic. So that makes you a candidate for cancer. You need to go get yourself checked. Anemia is just one of them. We can have nausea. Most commonly, we have severe loss of body weight, and it is not sudden. It is something that is gradual. It happens over a duration of time. And then now there are more specific ones. So for instance, if it is cancer associated with the urinary bladder, then you realize someone urinates more often than normal. If it is cancer associated with the prostate, may also present in a similar way. Blood and blood loss. So if you are losing blood, for women, if your menses are heavier than normal, those are just some of the telltale signs. And so cancer is more aligned, and the symptoms and signs are aligned to the specific type. The predisposing factors to cancer are quite a number, but we have those that cut across. Commonly, smoking is high on the list. People who smoke are generally predisposed to a lot of different types of cancer. And then now we have things like alcohol, which predispose you to liver cancer. For family history, the genetics, if a relative has ever had a particular type of cancer, those that are linked genetically are making you more predisposed to that. And then we have risk factors associated with age. There are cancers that set in with time. For instance, prostate cancer for men, the older you become, the more your chances of developing it. And the beauty is that these are things that we can test and find out. And also, we have cancers that are specific for children. They are only seen in children. And also things like lymphomas are more predominant in children. Some particular brain tumors are only seen in children. And then we have those for old age. So we have cancers that are gender specific, for instance, cervical cancer, which is only seen in women by virtue of them being women. So being a woman means your risk factor for developing cervical cancer is there. The management of cancer is broad spectrum. And it is broad spectrum because, like I started by saying, cancer is specific. So we have those management regimes that cut across. I'll start with the basics. The basics include proper diet. For someone recovering from cancer or who has cancer, then we need to give them proper diet. But then when you come to the clinical side of it, the clinical side of it has the medication that we give in terms of the chemical. From the word chemical, we call that chemotherapy. So these are the drugs that we give to patients with cancer. And most of the types of cancers actually we treat with chemotherapy. And then we have surgery. Surgery involves operation. So whatever it is, we do surgery for two main reasons. The first one is to go in and remove it. So we do it to remove the cancerous growth. Or we can also do surgery, not necessarily to remove the whole growth, but to do something we call debulking. So if someone, for instance, has cancer in the stomach and particular intestines are affected, then we go in and try to remove as much of the affected intestines as possible. And then the third one is radiotherapy. So radiotherapy is actually what most people are aware of. It involves shining of radioactive energy into cancer cells with the intention of destroying them. And then as far as physical activity is concerned, depending on the type of cancer that we are dealing with, we normally want patients to be as mobile, as fast as possible. One of the commonest side effects of surgery is actually, can be a complication of anesthesia that is being used. So some people may be allergic to particular drugs. Or during intubation, if we are going to do general anesthesia, then some recovery may be difficult. Recovering from the anesthesia can take a while. We have operating and going overboard in the sense that you cut into a nerve that you're not supposed to cut into, but that is currently being assisted by the use of electrodes. So for instance, if we're operating near the facial nerve, then we have electrodes that are placed on the face. So anytime the facial nerve is touched from inside the brain, then the electrodes go off. Chemotherapy, on the other side, is more of the one whose side effects are more noticeable, from loss of hair, because you've seen people who are undergoing cancer treatment becoming bald. That is because of the effects of the drugs. The drugs are really heavy. They become very nauseated, and so they feel like throwing up. They can't retain any food. Sometimes they have disturbances of the gastric tract, so their stomach, even if food goes into the stomach, it cannot be retained there. They have follow-ups with diarrhea. And for chemotherapy, sometimes if the dose isn't correct, some organs may suffer as a result of that. But then that is mitigated by having specialized people and specialized personnel who calculate the dosage based on someone's body weight. In conclusion, I would like to tell our viewers that cancer as a disease is really bad when we discover it at an advanced stage. But discovered at an earlier stage, most of them, stage 1 and stage 2, we're able to deal with that very well and treat it and potentially cure it. But then the challenge is that most of us do not go for testing. So in conclusion, I would just like to encourage all our viewers out there to really consider the annual medical checkup.
About 1/3 of deaths from cancer is due to behavioral and dietary risks. Day-to-day nutrition of the average person in Africa has widely shifted in the recent past. Prolonged diet containing highly processed fats and sugars, low fruits and vegetables intake can easily lead to cancer. Kefa Nyanumba will talk to us about nutrition when it comes to cancer. Hello everyone, welcome to Health and Flavor. We have reached our nutrition segment, and on set we have Mr. Kefa Nyanumba. He is our nutrition expert. Hello, how are you?
Fine, thank you.
You're most welcome.
Thank you so much.
So today we're having a case study on cancer.
Yes, it's actually one of the most frightening conditions that we have nowadays.
True.
Yes.
Very true.
Yeah.
So then our case study is we are looking at a patient by the name Mr. Maxwell. Yeah. That's not our patient's real name. So Mr. Maxwell came to you with several complaints. You can see change in bowel, movement like constipation, blood in the stool, and
lack of appetite.
Yes.
Yeah, weight loss. And those are some of the common conditions actually many people, complain about.
Yes.
And we have different types of, cancers. But in the case of Maxwell, this is actually what you call the colon cancer.
Yes.
Yeah, and it's actually one of the conditions that really, affects many, many, many people.
Yeah.
And, by the time he came to see me, we had to go through, first and foremost, the dietary history. Yeah. And we are going to see some of the foods he used to take before the nutrition intervention, because nutrition is actually very important when it comes to the management of cancer. Yeah. Yes.
I can see the history. Mr. Maxwell takes red meat and he takes bacon on a daily basis, and he prefers refined starches like white
pasta, for example.
Yes.
Now, just to comment on the red meat. Yes. Now, for the patients who have cancer, we recommend that they really cut down their intake of beef, because beef takes a lot of time for digestion, and especially for Maxwell who has constipation, he needs to do something about that. So it's important that he cuts down the beef. Next is bacon. Bacon is actually one of the processed meats that, he needs to get rid of, because, most of the processed foods have what you call, preservatives. They have what you call, a lot of saturated fats, yes, as well as sodium. So he really needs to get rid of bacon. In addition, he also needs to make sure that he cuts down his intake of refined starches, especially the likes of pasta, because they don't have fiber. Now, fiber is very important when it comes to the management of constipation.
Oh, okay.
Yes.
I can see also that he smokes. He smokes a packet of cigarettes daily and takes only a glass of water per day.
Now, for smoking, we say everybody needs to avoid smoking. Right. And especially for someone who has cancer, yes, we should actually make sure that he stops smoking. But of course, it's important for us to understand that it's supposed to be a process. Yes. If he's smoking a packet of cigarettes and all that, he cannot actually wake up one day and stop the smoking. So he needs guidance, but it has to be a process. So
for our patients who's saying, for instance, if I'm smoking, what has smoking got to do with my colon?
Okay, what happens is, cigarettes have a lot of nicotine, okay, and nicotine actually affects the body in so many ways. And first and foremost, it affects the absorption of certain nutrients, right, and that tends to compromise everything, including our immunity. Right. Yeah, so, and many people who actually smoke complain of lack of appetite, yes, and once that happens, of course, we expect the immunity to be affected.
All right, yes, that is true. Yeah. And again,
Water was the other challenge. Yes. He doesn't like water. And, it's important for our viewers to know that we have 3 essential things that assist the body in terms of normal functioning. Yes. And one of them is water. All right. Yeah, so he needs to make sure that increases his water intake. Yes. And this is going to assist in terms of constipation. Otherwise, if he just takes vegetables and water is not part of the equation, then we are not going to get the desired outcome. Okay. So he needs to at least increase his water to, if he can take up to around 2 liters, which is average, that can be good. All right. Yes.
Our patient does not like taking fruits and vegetables.
Fruits and vegetables are very good, and in front of us we have, different types of fruits, and we have vegetable salad. Yes. Just to start with the vegetables, yes, vegetables are very good sources of fiber, yes, and fiber plays a key role when it comes to the management of, colon cancer. All right. And of course, in terms of getting rid of constipation, yes, because of the fiber content. They also contain what you call the antioxidants, yeah, that assist to get rid of the free radicals. Now, free radicals increase the risk of getting cancer. Okay. Yeah, so like we can see, we have different vegetables in front of us, yes, in form of vegetable salad. And the goodness with the vegetable salad is the fact that, when we can actually absorb most of the nutrients we get from these foods, because these vegetables, because they're not actually cooked. Okay. Next is vegetables.
Fruits.
Fruits.
Yes.
And we have different types of fruits.
Yes, we have some oranges, yes, some apples, and yes, passion fruits.
And passion fruits. Yes. Now, most of these fruits have a lot of fiber, which, yes, is very good. For example, if you compare an orange to a green apple, oranges, yes, seem to have more fiber, right, which is good, very good for people with constipation, yes, and colon cancer, of course. They also have vitamin C, which tends to boost the immunity. Okay. Because, we need to boost our immunity so that our body body can be able to fight disease on our behalf. True. So it needs to make sure that it increases, the intake of some of these fruits.
I see you also have a spinach, bunch of spinach here.
Yeah, spinach, like other vegetables, is actually very good. Fiber content, it contains a lot of fiber. Number two, it has what you call iron.
Iron, yes.
Yes, iron is very important because especially for the patients who have cancer, some of them are undergoing chemotherapy and they need to boost their blood count.
Yes.
So iron is very good. But it also needs, vitamin C from some of these fruits to assist in terms of the absorption of iron.
All right.
Yes.
So I've seen in our vegetable salad here, we have some beetroot. Is it a myth or is it true that beetroot really boosts our blood
count? Beetroot is good.
Okay.
Beetroot is actually very good in terms of boosting our blood count.
All right.
So it needs to be part of the salads.
Oh, okay.
Yes.
Now, again, wanted to find, can a vegetable salad be replaced by a meal? Can I say instead of eating a cooked meal, I eat, let's say, a bowl of vegetable salad?
No, by the end of the day, we also need other nutrients from, for example, the proteins and the starches. So we talk of a balanced diet that is supposed to comprise of vegetables, protein, and starches.
So is a vegetable salad a snack or is it part of
part of the meal?
Part of the meal.
Because we have 3 meals per day, the breakfast, lunch, and dinner. So it's supposed to be part of a meal.
So you can take it maybe dinner or lunch.
You can take your vegetables dinner or lunch or even in the morning. Sometimes people prefer adding, for example, some tomatoes to their bread.
Yes.
In form of sandwich and all that. That's still okay.
Encouraged.
Yeah. The other vegetables that can be taken as snacks, for example, carrot sticks, they can also be taken as snacks.
Okay.
Yeah.
All right.
Yes.
So then this marks the end of this segment. Thank you so much for your time. Our time runs very fast. But for our viewers back at home, I hope you have enjoyed this session. Until next time, from us, it's bye. Consistent physical exercise can help keep away certain types of cancers. Cancer patients may as well exercise under strict supervision of their physician. Exercise will not only lift up your spirit, but also help the body to expedite the healing process. Our fitness trainer, Nzuki, is here to demonstrate to us the kind of exercises that are fit for cancer patients. On this fitness segment, we're going to focus on cancer. We have various exercise equipment that are going to be used. We have the Swiss ball and we have dumbbells, we have the exercise mat. And on set, we also have Mr. Nzuki, who is a fitness expert. Hello, Mr. Nzuki.
I'm fine, Waka. How are you?
I'm fine, thank you. He's going to guide us, give us guidelines on the kind of exercises we're going to do with this equipment. But before we start, I have a question. Is it safe for patients with cancer who are undergoing chemotherapy to do exercises?
Yes, it is. But first, the most important thing, they have to consult with a doctor. We'll start with the stretches.
All right.
Right?
All right.
Okay, legs apart.
Okay.
Legs. Okay, good. Yes, that's good. Yes, hands beside your waist. Turn, lean back, feel your back. Spread your arms back. And take them forward to the toes. Let's go to the toes. To the side now. This is the left side there.
Okay.
And then to the right. And then up, join both of your arms like this. Lean. Then change your leaning. Change the other side. You feel your side stretching.
I can feel that.
Let's go. 1, 2, 3, 4, 6, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. You squeeze. Yes, let's go. 10. 1, 2, 3, 4, 5, 6. Good. Keep going. That's 4. that's 5, that's 6, that's 7, that's 8, that's 9, and 10. Yes, hold it up. Let's push 10 times. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Back at top there, you can do, as you have already done 10 repetitions of each set, you can do 3 sets, each of 10 repetitions, and it will be good for you. Now, we go to the floor mat, and that's why we'll use the Swiss ball.
So we put this aside.
Yes.
Okay.
Yeah, we are working on our herbs, right?
Okay.
We are working on our herbs. So that's what we're doing. Support your back. You squeeze the ball. It's both of the legs from the sides like this. You hold the ball like this with the legs. Like you press it with the legs like this. Let me show you what we are doing. I sit on my arms, I support my back, and then using my legs, I raise the ball, and then I raise it up and down for 10 times. Yes, and as I do this, my abs is tightened. Yes. Let's go. Nice. Let's go. Let's go. Now roll it. Go. Relax your arms. Yes, now roll it. Yes. Even close your eyes and concentrate on your back only.
Okay. That feels good.
One more. Nice. Now we are going to the last part, which is the stretches, the cool down stretch. Go for it. Feel the stretch there. In front of the right leg. In front. It's tough, eh? Not really hard. Now go for it with both arms. You feel the stretch?
Yes.
Yeah? Okay. Now, we are still there with it. Now roll it forward. To the farthest. Take your head lowest. Farthest. Keep going.
Yes, I can feel the stretch.
Okay. Now take it now in the
Towards
front.
the left.
Yes, left
the front
leg.
of the left leg.
Yes.
Like we did with the right leg.
Yes. And turn. Keep going. Keep going. Now look at the camera. Yes. Yes. You feel the stretch here?
I can feel the stretch.
Okay, now we change for the other side. You can just carry it. Okay, can bring it here. Let's go.
Wow. This is quite some exercise. I can feel the stretches on both my hands.
This marks the end of our workouts for the day.
Wow. Mr. Nzuki, I can say for sure I have learned a lot. I've never known how to use the Swiss ball. And for viewers back at home who've never known how to use the Swiss ball, we've learned today. Remember, these exercises are not just for cancer patients, but they're meant for everyone.
Let us do a recap on today's topic of cancer. Cancer is a term used for diseases in which abnormal cells divide without control and can invade other tissues. Cancer is the second leading cause of death globally. Researchers estimate that 50% of all cancer cases are preventable. Prevention offers the most cost-effective long-term strategy for the control of cancer. Number one, tobacco smoking, secondhand smoking, and tobacco chewing can cause many types of cancer. Worldwide, tobacco use is the single greatest avoidable risk factor for cancer mortality, which claims approximately 6 million people each year. Number 2, dietary modification is another important approach to cancer control. Diets high in fruits and vegetables may have an independent protective effect against many cancers. Number 3, alcohol use is a risk factor for cancer of the oral cavity, liver, breast, among others. Risk of cancer increases with the amount of alcohol consumed and combined use of alcohol with drugs such as tobacco. Number 4, infectious agents such as Helicobacter pylori, human papillomavirus, hepatitis B and C, and Epstein-Barr virus causes cancer. Vaccine for hepatitis B virus and some type of human papilloma virus can reduce the risk of liver and cervical cancers, respectively. Number 5, pollution of air, water, and soil with carcinogenic chemicals contributes to the cancer burden to differing degrees depending on the geographical setting. Cancer prevention should be an essential component of all comprehensive cancer control plans. Many cancer prevention measures are cost-effective and reasonable to implement.
You may have tuned in and either you, a loved one, a friend, or someone you know is presently battling with cancer. Well, I am here to encourage you in the words of Zig Ziglar, a motivational speaker who once said, "I will live a hope-filled life every day. I will handle my problems as opportunities in a different, more efficient manner based on the power of advanced mathematics. You plus God is equals enough." Many thanks for your valued company to this end. This has been Health and Flavor, and I have been your host, Bill Hawaka. Goodbye.